As if this is the beginning. So, thank you all so much for joining us. My name is Sam Glazer Houston with the University of Minnesota Alumni Association. Really excited to welcome you all to our webinar today called Rocky State of Healthcare and Biomedical Sciences in America, featuring world-renowned Dr. Arthur Caplan. We're really excited to host you. This event is part of a larger series that confronts some of the most urgent and complex issues that face our future. So we do have a couple of other webinars that I'll point out to you, happening one next week around Antarctica ice cores, and more that will come out in the spring semester. One in particular we're excited to promote around the book Swiftonomics. Some housekeeping notes before we jump in. This session is being recorded today, and it will be shared with all those who have registered and also on our Goldmine platform so that it can be continued to be accessed. You'll also receive a follow-up email that includes our program evaluation and ways to keep being involved. So be sure that you stay tuned to that. If any questions arise during our webinar today with our expert speaker, please submit your questions directly via Zoom in the Q&A feature. We will be monitoring those questions as they come in, and we will do our best to ask as many as possible during the Q&A portion of today's session. Lastly, a thank you to the collaboration to make this offering possible. This could not have happened without the excellent folks behind the scenes at the University of Minnesota Medical School Alumni Board, as well as the Minnesota Medical Association, and of course, here at the University of Minnesota Alumni Association. The University of Minnesota is proud to educate more than 70% of the doctors that practice here in Minnesota to be the state's healthcare leader. You can learn more about that at mnhealthcareleader.umn.edu. And I'm so glad now to introduce Dr. Amy Sainer, who will provide our introduction for today's speaker. Let me get... Dr. Amy Sainer is a graduate of the University of Minnesota Institute of Technology, Mechanical Engineering in 1983 and medical school class of 1992, as well as a current member of the University of Minnesota Medical School Alumni Board. While a medical student, she was a co-chair of the Student Committee on Bioethics, where she first encountered and had the privilege to work with Dr. Caplan. Amy completed her residency in pediatrics at the University of Colorado and fellowship in pediatric cardiology at the University of California, San Francisco. She is currently a chief medical officer in biotech, specializing in clinical research of rare inherited cardiovascular diseases. It's been an honor to work with Amy in preparing for this session today, and I'm very excited to turn it over to her now.
Well, thank you so much, Sam, for the kind introduction, and really to everyone for helping and supporting getting us today, and for all of you who have joined. It's my profound privilege on behalf of the Events and Engagement Committee of the university's Medical School Alumni Board, UMAA and MMA, to bring you this webinar with Dr. Caplan. I first encountered art about 35 years ago as a medical student at the university. And as co-chair of the Student Committee on Biomedical Ethics, I got to know and work with him. And this really set the foundation for my thinking about personal autonomy and beneficence, key ethical tenets which have cropped up time and again throughout my career in pediatrics, cardiology, reproductive health, inherited genetic diseases, and clinical research. In our ever-changing world, I felt that hearing from Art today would be both grounding and inspiring, and I'm so grateful that he agreed to join. Dr. Caplan is the founding and current head of the Division of Medical Ethics at the NYU Grossman School of Medicine, as well as a former faculty member and director of bioethics at the University of Minnesota Medical School. He's authored or edited 35 books and over 880 peer-reviewed papers, and he regularly appears on the national media, where you've probably seen him as a commentator on healthcare and ethics. Dr. Caplan has advised the World Health Organization, our federal government, the United Nations, and numerous biomedical organizations on wide-ranging issues from organ donation to vaccine ethics. He's received numerous national awards for his public service, research integrity, and in humanitarian leadership, and holds 8 honorary degrees from colleges, universities, and medical schools across the U.S. Art, I'm thrilled to have you here today. Thank you for coming to address our Minnesota alumni and Minnesota audience, and I'll hand it over to you.
Thank you so much, Amy. Can everybody hear me okay?
Yes.
It's been a real pleasure to have Amy grow and flourish and achieve so much in her work and career. And it's always a real pleasure to have a chance to speak to the medical school alumni, the medical association, and the U alumni. Uh, I certainly keep track of things going on in Minnesota and have always tried to be supportive of the U activities. And so I really do appreciate the chance to speak with you. On the other hand, times are not so great for speaking to you. A lot of upheaval, what I would call a war on science and medicine. And I'll try in some opening remarks to uh, set the stage about why I think there is a war and that it has been a longer standing war than maybe some of you think and what that means. And then I'm going to try and be a little constructive and positive and make some suggestions about how to engage this war, both in terms of what might happen in Minnesota, but also nationally and even a little bit internationally. So let's take the next slide. So some people think it's just chaotic at the federal level and in some states. I don't. I think it's a deliberate war on science and academics taking place at the administration level. There's no more staunch warrior on science than RFK Jr. And when he moved into being the top official in the country for health, that put him in a position to espouse views that I think are not friendly to and are inimical to science and healthcare. And that battle has been going on at the state level in places like Florida. You may know that the Surgeon General there announced not too long ago that he was going to do away with all vaccine mandates across the board, uh, basically putting, I think, the kids in Florida and those who might encounter those kids through travel at grave risk of recurring communicable diseases. And you can see these battles going on even in states like Idaho, where a law was passed not too long ago to prohibit any mRNA derived vaccines. We don't have to go into what they are, but I will say they're among the most promising vaccines that we have for cancer, not just infectious disease. And I think this idea of banning vaccines that come from that particular platform is again illustrative at the state level of the kind of war that is being launched on science. And many of you are familiar too that we've had a lot of federally sponsored science shut down, defunded, purging of government health and science agencies, of leadership of highly qualified people in many different arenas, not just health, some in climate, some in areas like food safety, censoring research, basically telling people they can't publish numbers, can't publish data, what I call apparatchiks, deliberately choosing that term, bureaucrats put in charge of funding, not because they're science experts, but because of their ideology, and even suggesting that publishing will be restricted to certain journals and creating new journals that they see as in accord with the value system of the current administration. Seen clinical studies abruptly canceled and shut down, both overseas, PEPFAR, leaving people taking experimental vaccines for HIV in the lurch, but it's happened here too, as I'll come back to in a minute. Threatening with defunding and closing universities who don't clear up their websites from terms like diversity and inclusion and equity. And I will say I consider those terms, not the practices that were always conducted under them, but the terms themselves and the values, quite defensible and important. I don't agree that inclusion is a bad thing in science or anywhere else in America. Scrubbing history from our museums is part of the war on science because you remove scandals and problems that have beset American science and international science because they are uncomfortable or for some people smack of reverse racism. But I don't think the way to handle that is by scrubbing them out of our history. Got hiring freezes on. And in many agencies, federal and state, there are people being appointed who hold fringe views. The latest round of this being the connection between autism, Tylenol, and circumcision, which we could probably spend an entire hour debunking, but it's just a fringe view. Let me leave it at that. Next slide. So, as I said, some people think this war just got underway when the second Trump administration started, and Kennedy in particular was given authority over federal science, but I don't think that's true. I think the start of the war goes back at least a decade, maybe a little more. Charlie Kirk, who was murdered in 2012, set up his uh, Turning Point program. And when that happened, about 2016, he created a watch list as part of his program to expose and document college professors who students say discriminate against them as conservatives or advanced leftist propaganda in the classroom. That watch list is pretty old, and I hated it when it first came out. It seemed to me a kind of bullying of professors. I should also say I made that list pretty quick for criticism that there was too much racist and eugenic thinking in some of the statements about immigrants and other people in the US that the president had made and other people had made during the campaign, the second campaign. Uh, I believe that it is important to have balanced classroom presentations. And I don't know, Amy or others could say whether they felt over the years that that was true for me in Minnesota, but I've always been willing to explain my biases, my starting points, what I think are assumptions, and open to let people attack and debate and try to get readings that express other points of view on all matters. And I don't think the way to handle ideology and disputes like that at the university level is to have the government come in and monitor or to have kinds of ratting out of the professoriate. But that was going on a long time. Next slide. Second big problem for science, we have to just admit this, and scientists don't like to, and doctors don't like to, but COVID was the Waterloo of this war, and it took place long before current events. COVID was a disaster, in my view, for public health, social science, and biomedical science. A panicked world, particularly when it first broke out of China, spread to Italy, showed up in the US, lost trust in doctors and scientists that they felt were not able to contain this very deadly at the start pandemic with millions dying, and the world panicked because it thought that many, many tens of millions more would die. So putting faith in biomedical scientists, thinking that we had the best public health in the world in the US, did not protect us from this nasty COVID virus, and that panicked people. Worse, many people began to blame science, medicine for this pandemic. You remember all the debates that still go on about, did Anthony Fauci work with Chinese scientists to develop bioweapons, and that was the source of COVID, an escaped viral bioweapon? I don't believe that story is true, but I'll leave it to people more expert than me to say why it isn't. But I know Fauci, and I don't think he would be putting the world at risk by trying to work with bioweapons or dangerous, what's called gain of function research. But you have a pandemic that puts the world at risk of death initially, and then blame for it. Where did it come from? Came out of China, maybe from man made activities by scientists. That's a bad, bad situation, undermining trust in science long before current events. Disinformers were clobbering fact messengers all throughout COVID, clobbering them. Uh, just a lot more nonsense and silliness all over the web and the internet and mass media. Older anti science forces woke up. That was Kennedy, by the way, back then. Anti vaxxers, alternative medicine people, some religious people who weren't especially fond of scientific explanations of things like creation. And RFK Jr. found a loud voice, and Trump owed him, in part, his reelection, and he was put in charge based upon Trump saying, have at health and science, do what you wish. Uh, and what he wished had become pretty clear through COVID. And so, what I'm getting at is that science got outflanked, outgunned, outspoken, outcommunicated as a result of COVID, again, long before the current administration began its attacks. Next slide. This is a pretty good book if you want to see sort of the rise of the anti science movement. Uh, Peter Hotez is a friend of mine and a tough, heroic figure trying to communicate facts throughout COVID and up to the present day, trying to keep people informed. But he also suffered through threats, bullying, people coming to his house threatening to kill him. And he was a very lonely voice. If you looked at science, it kind of retreated post COVID, leaving the field to a few people willing to communicate publicly about what was right and wrong, true and false, about COVID and its aftermath and other public health challenges, and really was set back terribly. Next slide. Well, today, due to those events, beginning with ideological attacks on health and science way back in the 2012 to pre-COVID era, COVID really evaporating trust in science, medicine, and public health in many circles, not all, but in many. Then we saw a final victory achieved by the anti-science crowd as they came to power. They did what traditional autocratic governments have done when they don't like science. Here I'm thinking about Stalin. Here I'm thinking about Hitler. What do they do to control science when it doesn't message in the way they want? They capture the institutions by appointing loyalists, not qualified published scientists. They purge existing staff from their agencies. That's what we're watching with the job cuts. They undermine results that don't match the state narrative. One of the things that bothers me a lot is the insistence by the federal government that there are only two sexes, when we know biologically things can be more varied than that at the biological level. I'm not talking about gender identity, I'm just talking about genes, chromosomes, mosaicism, and other phenomena that we know are true, that complicate how we view sex. Climate denial, and as I said, the mRNA bans. And we've seen a lot of suppression through censorship. Florida basically pruning ideologically people from its state universities. I consider suppression going on in the academic world when people are shutting down their DEI and DEI websites and programs. As I said, I find those concepts and values defensible. Did people go to extremes and carry out, get silly even, particularly in the universities in the name of DEI? Yes. But to say that there's no meaning to these concepts, I think is wrong, but that is an ideological stance, and you have to be pure about it or the administration comes after you. Next slide. So old existing strategies to fight back in the name of science and health haven't really worked. I know this from many decades of trying to bring science, health, and bioethics into the public sphere. Uh, Fighting disinformation and misinformation is very hard on an internet that doesn't distinguish between what's true and what's false, and who's leaders, the people, corporate leaders in charge, are there for clicks and advertising and audience, not for truth. And if we think they're ever going to enforce that on the web and the internet, forget it. That isn't ever going to happen. And the old ideas of science and health, not my field. They're attacking public health. That's not my problem. Or I leave it to my leaders. Or if I just stick to telling the facts, I'll be okay. By the way, science is value free and apolitical. I just pursue the truth. None of these ideas hold up against ideological attacks. By the way, they didn't do it historically under Mao, under Stalin, and under Hitler, and they're not going to do it here. And I don't mean to make a direct path from those three horrific historical figures. But when ideology really is aimed at undermining science, the notion that science has to be value free and apolitical is just not going to be a response that the those putting it under attack are going to accept. Next one. You can skip that. Let's go on to the next one. Although one thing I did have on that slide that I have to mention is one other outlet that many scholars use, bioethicists do, is to write books in response to the war on science. I showed you one by Peter Hotez. Sadly, books are dying. They are read by the elderly. I have many nephews who are under the age of 30. They don't know where their library is. They haven't picked up a book. They get no information from books. So I'm sorry to say in front of this audience, who I'm sure still has many book readers, not because they're elderly, but because they know better. But in general, fighting that war by publishing books, it's not a particularly valuable way to go. Next one. Even if you're doing books on tape. And it's hard to compete with disinformation's flashy style, relatability, money, celebrity status. There are many celebrities who are out there. I think of Gwyneth Paltrow continues to get passes despite her goopy science. People don't go after her, and there are many, many others who promote nonsense or incorrect information. Even Oprah has done that. Uh, there are people she spawned, like Oz and Dr. Phil, who do worse, in my view. And the right has a very powerful conservative populist media ecosystem, and it gets its messages out very effectively and knows how to communicate well. The media are starting to shift to echo on the science front some of these MAGA views. Uh, and science itself has lost some faith in its ability to be scientific because it's beginning to lose faith in the adequacy of peer review, which we can talk about later in questions. It's even got many people arguing that the best science can do now is just release everything early in preprints without peer review. And there are many, many journals that are pay to publish where if you have the money, they'll publish your article. And they look just as legitimate, these journals, as the mainstream traditional ones. And they're trouble. They publish studies that then people like Kennedy or his acolytes can submit to public hearings or put into the literature. And we all know this game. Pretty soon, a paper from a pure pay to publish, non peer reviewed journal is getting picked up by AI and regurgitated in a chatbot as valid science. Why wouldn't it be? It's cited by government officials in high office with a journal article. So we haven't figured out how to manage any of that, and that weakens uh, the ability to distinguish what's real science from what is paid science or made up science. Uh, and fighting on that battleground failed to stop a lot of unqualified and fringe appointments at the state and federal level of people. And again, I'm not just talking about their politics, I'm just talking about the inadequate history of publication being certified as competent by their peers, not by some political litmus test. Next one. So quickly, and then we'll get to, and you can skip this one too. We'll get to an opportunity to do Q&A about it, whatever you want. It doesn't have to just be about this war. So what to do? Well, we do have to speak up. Let your congressperson know you support science. It's important to you that the midterms are coming and they should know where you stand about this war and that it is uh, ill thought through, dangerous, harmful. It's bad for the state of Minnesota. It's certainly putting under attack healthcare institutions, the future of the next generation of our kids from getting better cures. It's putting them at risk as we regress away from established and known, proven public health policies. And so getting out there, speaking up, yes. And people might say, is this a one issue thing? Yeah, it could be. I think focusing some of our political effort, whatever else people want to speak about, we need to stand up and defend science more loudly. Next slide. In addition to that, it's important to tell stories. I mean, what I'm saying to you in this war is that many times scientists try to respond, as scientists do, with factual information. That's what they strive to find. That is what we teach people is important. Amy can tell you if anybody utters the words evidence-based medicine one more time, it'll be one more time too many. We all swear that we're going to do things in mainstream medicine that are evidence-based, evidence-tested, evidence-confirmed, but truth dumps don't work. They're not value-laden, they're not normative, they just are a regurgitation of facts. What people do learn from, I've picked up over the years, is cases. Listing facts is far less compelling than telling stories about real people. And you don't even have to use real names. You just say what the experience is. And it doesn't have to be a doctor or a nurse or a physical therapist or a social worker. It can be a patient or someone who has a family friend who's been through this. Yeah, this is a 6-year-old whose cancer treatment was cut off way back in February out of the blue uh, down in Tennessee. That kind of story and saying to the government, stop killing our kids, is the kind of normative message that the facts need to be supplemented by. So when we're out in public or talking to neighbors and friends, messaging, I think, has to be linked to stories about the negative impact that the war on science, healthcare, public health brings. Next one. We had a patient here who drove 2 hours to get her breast cancer chemo, only to learn that that research study was canceled. And it wasn't today, it was last week. But very recently. Another person had their clinical trial stopped with no restart, no plan, no information about what to do. Just boom, brother-in-law's chemo in a different trial, cut off with no instruction. What should he do now? I mean, literally, you can't come here because everybody on this team is gone, and then what to do? Another story that is an example that we need to tell is, yeah, you can make measles vaccination more easy to opt out of, and you will see a continuing climb in outbreaks. South Carolina has got it now, many other states, Texas, in measles. And again, I say this with a little embarrassment in front of Amy, who's got much more pediatric knowledge than I do. But in addition to killing kids, measles disables them, puts them in ICUs. You don't really want to wind up having a sick kid from measles. It's not just death. People tend to say measles is a minor disease. It's not minor if you have kids, newborns with little immunity, kids with diminished immunity, elderly people at risk because their immunity is less, and so on. Next one. Other ways to fight this war. I don't think we speak about this enough. Science creates jobs. It directly creates jobs in a state like Minnesota. And when you gut science and medicine, then all over Minnesota, people lose work. I'm showing you over there a bunch of specialized healthcare jobs that are directly in healthcare. And then when you make your cuts, these are all people who wind up being vulnerable to losing their jobs and having less employment. STEM related work nationally, at least the last number I could find for 2021, is about a quarter of US workers. A quarter. Sorry, I think I'm being afflicted with the measles here. Um, and today the Nobel Prize was just given to three researchers who explained the importance of scientific innovation to drive economic growth. Just today. We got to point out what it means when you war on science, STEM, technology, when you discourage young people from going into these areas, you're putting economies like Minnesota's directly at risk. Next one. Science creates jobs, in particular cities that are heavily into healthcare provision, tech, and they're in red cities too. You can read them. There's a bunch of cities right there that are all heavily committed to healthcare provision or STEM or science. And they are going to get hit hard if science really is allowed to stagnate or is really worse, cut back. Next slide. Before you change it, remember too, I just wanted to point out, let me go back once for a second. There are indirect jobs that support our healthcare system, our science work. Industries, restaurants, conventions, vending, the travel business, people who are involved in providing supplies, devices, shipping them. The economic impact isn't just who's going to wind up not having a job as a social worker or a researcher if these things are cut. It's all these ancillary industry jobs that are at risk too. Again, I don't hear us speaking up enough about that. Now, next one. Need to find allies, patient groups. Remember, I told those sad stories about what's happening to kids. We need to ally with patient groups. They are very powerful voices standing up for science. Congress people listen to them. Nothing worse than having a group of aggrieved mothers standing in your office at the state legislature or in Washington saying, "Stop killing my kid." They're a very powerful lobby. We need to tie to them and connect to them and work with them more. Religion, I didn't want to depict it in this talk as an enemy. It isn't. It's often pro science. It may have taken the Catholic Church 300 years to figure out that it could live with Galileo, but okay, it did. It got there, and it got there much faster with things like evolution. Other religious groups absolutely see faith traditions as a different kind of belief than science and can coexist very well. And I've yet to encounter, and I'm going to say this deliberately, any serious organized religion of any size that is anti vaccine. Not one. Not one. So let's get these allies going. And there are foreign allies. Science is international. Our science groups and associations should be using their websites too. You know, as soon as Trump, in that crazy press conference with Kennedy, announced Tylenol was the cause of autism, there were at least 6 or 7 health ministers from all around the world instantly online denouncing that as ridiculous. And that's the sort of thing that we can tap into and say, look, it's not just us here, scientists saying we don't agree. It's worldwide. Experts are saying they don't agree. Next one. I think we could use our students more than we do. I've tried to have a project coming out of NYU. I call it Give One Talk. Started about a year ago. Basically asking each medical student, public health student, nursing student, get out in the community and give one talk at the local level about some issue of health, public health, or science. I don't even care what it is. Just let them see you, let them see the enthusiasm, let them see that you are relatable, let them understand why you went into and got interested in a career in science and research, helping others. It is a very effective communication uh, skill, and we don't use it enough. Get out to the high school science fair, get out to the 4-H club. I don't know if anybody showed up this year at the state fair, sort of promoting science and healthcare stuff, but whatever it was, do more. Debate teams all over the place. We don't be getting to church. We don't use our young people enough, and they're far more relatable frequently than our senior, wondrous old timers like me. They are just the kind of people that I think audiences relate to across the political spectrum very well. And let's use them in our museums, aquariums, space programs, dog and horse shows, local state fairs, art shows, concerts. What does he mean by concerts? Well, you can always do a talk beginning or after a concert. You could do something on the science of what's going on at different kinds of concerts. There are plenty of forums out there at the local level that we don't use. And what I'm going to say here is the battle to defend science has to be won not only nationally, but locally. And we have troops and we have people with skills, and we don't encourage them, and we don't organize ourselves to make it happen. And I'm going to tell you, having sat over the years on a whole lot of promotions committees, the last time I hear somebody say that Amy Sainert is merits promotion at some university because she's been in part a very effective communicator out to the public and helped to defend science in congressional forums and has written for more popular media, will be the first time I ever hear such a thing. If you don't reward it and you don't honor it and you don't commend it, then no wonder science and public health get outflanked by know nothingism and disinformation. Next one. Even our veterans, the Minneapolis VA and other places, there's a huge federal workforce that depends on science and healthcare. Our vets want the latest and the best healthcare. Cuts really hurt them. It's a betrayal of a promise to prioritize them for their service, putting not just their regular care at risk, but the future of their care at risk. And why aren't we engaging their voices more loudly in saying what is wrong about cutting back or warring on science? Next one. So here's the last idea, and then I'll open it up for questions. I think wealthy states, regions ought to think about setting up programs to fund young scientists. I'm going to call it the Curie plan, intentionally being cute about famous female scientists, but that's just me being cute. Take grad students, take postdocs whose futures are in trouble. Their grants are being cut. Have a regional program, offer them 2 years of support, make sure they get a mentor, tell them they can get some housing, ask foundations and publishers and local companies that supply science to kick in some money. And let's let Minnesota, for example, stay at the forefront of science and research by not allowing its youngest, newest people to be discouraged and cut out. I don't see any collaboration that says, well, if the feds are going to chop out 50% of all the postdocs or not have any more programs for graduate students, well, why can't regional or state alliances be formed to help some of these people and provide the economic advantage that they will back to those states and regions? So you can kill the slides. At the risk of having talked too much, I didn't want to make you think that there's nothing to do. There are lots of things to do. You just have to have the resolve to do them, in my view. And I think people run around saying, what are we going to do? And this is cut and that's bad. And over here, people are disinforming and so on. Well, hopefully, some of these ideas give you some suggestions about steps I think we should be taking to help at least buffer the war on science. All right, so I'll shut up and let's see if we got any questions or comments or about anything, whatever.
Right. Wow. Oh, that was amazing. And we did get a number of questions. And I would like to say, in terms of some questions we had before that you touched on, especially that kind of call to action, there were points around, health equity becoming politically charged and public trust in medicine eroded. And there were questions about how can, clinicians and the individual physicians stay committed to, the concept of equity and rebuilding trust. So, we're going to have a subsequent discussion on this in a couple of weeks with our alumni board, and I invite everybody to that as well. Thank you for what you offered there. But in terms of like in the clinic, in the trenches, on the ground, any words to the clinician kind of facing these issues head on and how to collect their voices in this?
So I'll just say three things. One, I was at a number of universities, not the U, but others, where white men said to me, I'm never going to get a job. I can't get promoted because of DEI. I'm not going to tell you there weren't abuses and weren't people who went to extremes. But the idea of equity as a goal of healthcare is noble, important, and I wouldn't stop trying to defend it. I mean, I'm trying to defend it, even though, you sort of look around the corner every day and think, is this the last time I'm going to get to defend it as they haul my butt away out of my professor job? But I think you got to try, and I think you have to do alliances. So I do like the medical societies, the professional associations as voices, giving cover, giving unity, as opposed to getting individuals. Secondly, I do think talking in the community, I saw a survey this week. People said, who do they trust the most about their kids' health? 87% pediatricians.
Mhm.
Okay, then let's bring that voice out, and it doesn't have to be in the office. I'm not always crazy about politicizing. I don't go to the doctor particularly to get a lecture on values as part of my removal of my bunion, but
Mhm.
outside, sure, then I want to hear those voices, and I think we're not doing that very well, and that should be beefed
Mhm.
up with networks and opportunities to play speakers and people signing up to say, "I'll do it. I can do that," and then writing for the local paper. It's an electronic age. You put something in the Otter Tail County Weekly Blather, and it'll get picked up and put online and shown all over Minnesota, much less likely the world. So let's try to do more involvement with our local community outlets to correct things, point out the value of things, say when someone's care has been interrupted without help, and so on.
Awesome. I'll just make one comment. Some of us who still read books also have still a smallpox mark on our on our arm. But there's several comments in this vein, which is what motivates the anti-sciencers? What's the end game? Is it about destroying the truth so autocracy can prevail without resistance, or sort of, what what's the point of that war on science and medicine?
Again, big question, but I'll just make 2 points. One, I do think that some in the administration, federal, in the MAGA movement, see science as an enemy to a value oriented set of political goals. Let me give you an example. Joe Lapato, the Surgeon General of Florida, the guy who said he was going to do away with vaccine mandates, it was pointed out to him what the consequences might be of to children of death and disability if you did that. He said, I don't care. I want people's choice and right to decide to override those facts. So that's a values commitment. And you have to engage that values commitment and say, that's wrong. Your values are out of whack. I do think it's more a values fight than it is a science fight, and science is seen as dangerous to where the values sometimes where proponents there want to go. The other thing I'd say about what's motivating this is I don't underestimate panic. That legacy of a worldwide millions of death uh, pandemic left a lot of people unhappy with science, unhappy with public health, wondering even did public health cause it? Did it somehow come from uncontrolled science? So there's a lot of fear, and it's going to take a lot of effort to regain that kind of trust. But I would not say it's just Donald Trump woke up one day and launched a war on science. It goes back to
Mhm.
this. You locked me up, you masked me up. My kid didn't go to school. I couldn't see my friends, and still this thing went out of control.
All right. Um, so many good questions and points, and I'll just share with everyone that we'll try to get these to Art as well for responses afterward if we don't get to it here. So uh, there's a comment, your idea of forming regional partnership is great. I know the Mayo Clinic and University of Minnesota work closely. Do you know if there's anything in the works with those particular institutions?
I don't, but I think two powerhouse places, could then be at least the organizers and then try to draw in, the huge Minnesota science, tech, health industry from 3M all the way over to even Cargill, thinking about nutrition and all the rest of it, and say either we'll do it and guarantee the future as best we can of our young scientists and doctors who are at risk because of these grant cuts, the young ones, or maybe we could work with, like-minded states elsewhere and do the same thing. But I think it's an opportunity. It may be a miserable reason to have to do it, but I'd rather stay ahead of this game. I'm trying to get Connecticut to think about doing it with New York at the state level, and I'd be happy if all of New England jumped into it too. Boston clearly being another big, where I'm from, a big science and healthcare hub, and you could see it in the Bay Area pretty easily too. And maybe all of them can collaborate. That's fine. So I don't, but hopefully, maybe this will stir up something.
All right, and then another hot topic, of course, which you touched on with your comments about how publications are coming out aside from traditional peer review process. So what are the risks and benefits of incorporation of AI in healthcare, as well as tied to an equity question, as AI reshapes healthcare, how do we ensure that the innovation doesn't widen the disparity because of basically what it learns from, I would say. Comments about
Well,
AI and healthcare in this mix?
yeah, I mean, I think again, adopters of AI into healthcare systems should ask the developers, what are you doing to help guarantee broader access? I don't know, we can get universal access, but is your telemedicine available? Could somebody in rural parts of the state access care advice that's reliable and vetted sources, not open chatbot AI gurgling back 20% hallucinatory nonsense? But I think the adopters do have power and they can make access part of what they're looking for. I want to say sneeringly, not just billing, but that's a little cruel. But access too. Let's make that a condition that we want our developers to go after. The other thing that I think is just true, again, it's what I said about books. Sorry, Amy, but
Mhm.
you know, the number of people who are getting their healthcare online under the age of 30 is enormous. I mean, the idea of going to the doctor's office and sitting there with some old Reader's Digest magazine, I'm not gonna
Fish
do
tank.
that. I'm not doing that. So we've got to, within the mainstream, begin to realize AI is the future, remote is the future, monitoring and surveillance and sending our blood pressure and our, sugar levels and our oxygen saturation through the internet is going to be what it is. And, that's where access is going to be. It isn't going to be people showing up at the ER and sitting there for 8 hours. They won't do it.
Very interesting. So in terms of that with access, perhaps that gets better, but there's a question, is it ethical to allow undertrained paraprofessionals to expand scope of practice, like optometrists doing eye surgery and intravitreal injections, nurse practitioners administering esketamine without physician collaboration in the name of access? This is happening in the VA system and in rural America.
You know, it's a problem. We do need to insist on quality control. Here's a test though in a different direction. So I decided to see what I could get sent to me through AI telemedicine. So I went online with one of the big sites and said, I am depressed. Will you send me mental health medicine? Within 20 seconds, yes. I am impotent. Will you send me erectile dysfunction drugs? 23 seconds, yes. I have baldness. Will you send me medicines to treat me? You get the point. So the old fights, anesthetist, nurse anesthetist, that sort of battle, yeah, I mean, let's have the fights and make sure that people, we insist on qualification, but I see a much greater threat from non-doctors and non-anything going online and delivering stuff to us, and they're already doing it, right? Plus, the whole wellness industry is distributing $1 trillion worth of stuff in the US with no qualifications and a lot of nonsense. So, what I'm saying here is I'm not against engaging the battles between various sub-professional organizations. But the big war is really coming about how you're going to access stuff when it's just some guy in the basement in Nigeria.
Wow. Okay. Well, I see Sam has come on. I want to make one more comment here too, and complimentary. Why hasn't there been more pushback by what this person thinks is the majority of people in the country who agree with the premise behind your wonderful talk? So why hasn't there been why isn't that voice percolating up, I guess is the question. And I think it's been very stimulating, and I hope creates the opportunity, like you said, every problem, opportunity, and you've given us some ideas on that. But any last comment about where's the silent majority? I'll say it that way.
Well, the critics and the war on science is being effectively fought by picking off one by one. So that's a problem. You got to get the professional groups, universities to ally, people to collaborate and cooperate, and then let them brainstorm up ideas. Secondly, we're not taking advantage, if you will, of our youth to get out there and help us, and they will, and they're enthusiastic. But that's not how professors think. Why would I engage youth? They're youth, but that is exactly where you should go, I think. And then science has to get off its old fashioned habits. They're going to believe us because we're authorities and we spent 25 years in the lab and I know the damn answer. And these are the facts. That just won't wash in the values fight that we're having now. So I guess I'm saying part of the need there is to rejigger the mindset. Then you could start to open up and say, where's our patient allies and why aren't we pointing out this job market situation, things like that, which don't come easily to people who are working at the bench.
Fantastic. Art, thank you so much. I'm going to turn it over to Sam. I think she might have a few more words to say.
Thank you, Dr. Amy Sainer, and thank you, Dr. Arthur Caplan. Wow, thank you for the past hour of phenomenal conversation. I know as someone who does not work in the medical field, I am thinking deeply about all of these topics, and I know you brought tremendous value to everyone that was tuning in. So thank you so much for your time today. We know these thought-provoking topics are really key to discuss and understand more fully, especially in today's climate. And we appreciate everyone for tuning in to today's conversation. Sadly, that concludes today's webinar. Please watch your inboxes for some key follow-up messages. And then I see Haley popping on if you want to add anything from the Minnesota Medical Association before we wrap up.
Yes, just on behalf of the MMA, wanted to thank everybody for joining us and for the Alumni Association for partnering with us, and of course for Dr. Caplan for sharing all of your thoughtful insights with us as well. And just a quick plug for our work, the MMA does offer quite a few health equity conversations, resources, educations, workshops, lots of things for physicians who do want to talk about these issues, who want to learn more about them. And so I'll just drop in the chat our health equity website, which you're free to visit at any time. And thank you.
Amazing. Thank you, Haley, for adding that. And thank you again to everyone, especially Dr. Art Caplan.
Thank you.